There is a new approach and new hope in the treatment of a deadly type of infection.
Doctors are now using a harmful bacteria to make people healthy again. CBS 2's Dr. Max Gomez here now with more on this new method and how it could help in hospitals and nursing homes. Doc.
That's right, Maurice and Christine. The bacterium is called C-Diff. That's short for the scientific name of a very nasty germ that causes 500,000 serious infections each year and 29,000 deaths. Victims are usually those who've taken heavy antibiotics for some other infection, allowing these resistant germs to take over. Now doctors are fighting fire with fire. Cheryl O'Riordan loves to bike, travel, and volunteer, but a bout with this bacteria, C. difficile, changed her life.
I felt like the lining of my colon was being ripped out. I needed to be near a washroom at all times.
C. diff is a bacterium that can take over and colonize the gut, producing toxins that cause severe pain, colitis, diarrhea, fever, and even intestinal perforation and death. Even when successfully treated, a quarter or more patients see a return of the infection. However, there are strains of C. diff that do not make nasty toxins. They're called non-toxigenic strains.
If that strain can be established in your gut, it will keep out the toxigenic strains. In fact, it may even force out some of these toxigenic strains.
Researchers studied 168 patients who received varying doses of the non-toxigenic C. diff strain or a placebo.
The secret clearly was to get these patients to be colonized with this non-toxigenic strain, which just means that these strains set up housekeeping in the GI tract. We got about 70% of patients to colonize with this strain after treatment.
The study appears in JAMA, Journal of the American Medical Association, which showed that the non-toxigenic strains did not result in any severe side effects.
We were able to reduce the recurrence rate from 30% in the placebo group down to 11% for all patients who got the non-toxigenic strain. And for the dose that worked the best, the recurrence rate was 5%.
Now, this is the first time that doctors have taken a strain of the same bacteria that causes a deadly disease and actually used it as a preventative. Then in a few months, when the patient's normal gut bacteria recover, even the non-toxic strain gets pushed out, restoring the intestine to normal. Maurice?
Okay, doctor, thank you.